Hello everyone, my name is Stacy Cable and I am a Simulation Service Line Educator at Atrium Health's Carolina Simulation Center in Charlotte, North Carolina. I happen to be a registered nurse with a med-surg background. I've been in healthcare simulation since 2007 and have experience with all learner levels, from pre-licensure students to expert teams training in the acute care environment. I have been certified since 2015 and am familiar with creating complex care events to test new spaces, sustain facility accreditation, evaluate team response, support patient care initiatives, and strengthen curriculum objectives. My primary interest is creating and implementing simulation opportunities for interprofessional teams in the in situ setting. I'm really excited to be with you as we explore this next module. All images throughout the presentation are royalty-free from clip art, Pixabay, or permission given by the organization. Welcome back to the second part of Domain 3. The frame of this domain is moving your simulation from theory and curriculum development into practice, foundations for running the created simulation, the processes and activities. First, we will discuss how to plan and design simulation activities. As we look at the design process, we will explore the Kearns model of curriculum development. This framework outlines how simulation-based activities are intentionally designed, implemented, and evaluated. You will notice that the design process is informed by all the other theories and frameworks we have discussed earlier. Also note that this process is very mercurial, as depicted by all the arrows that move forwards, backwards, and actually connect each phase to one another. This is to help you understand that while we do start at the starred problem identification and general needs assessment phase, it might be that as we progress through in our design, that we uncover a need or a question that needs to be answered and might need to jump ahead a little bit or go back. This process is not meant to hinder or bind you or conform you to one direction. It is, in fact, very mercurial and should support you as you move through the creation of your simulation activities. Conducting a general needs assessment. You need to identify the problem and who it affects. In this step, it is important to understand the actual or current practice of the learner group and the standard of best practice for the situation. The gap between actual practice and the ideal practice is where the educational opportunity lies. This phase is sometimes referred to as the global needs assessment. When conducting the general needs assessment, an educator may realize that sometimes a simulation-based activity is not the appropriate answer for the educational need. We will now take the general needs assessment and work through what the simulation activity will specifically target. This step will help us begin to understand learner needs and assist in constructing measurable outcomes. Differentiating a targeted needs assessment. The educator will move from a general understanding of the concern to understanding the specific learner group. To do this, an educator will need to assess the learner and their learning environment. Also, identify their resources, some of which could be, have they had any previous education on this subject? What certifications or credentials do these learners hold? If these are staff members, will they be reimbursed for their educational time, or will they be educational credits? Will the staff be on the clock, or maybe award CEUs or trauma hours for participating? What are some perceived deficits? Are there things that will pose a barrier? Are there institutional concerns? Are there policies or procedures that you can rely on? You also need to identify the key stakeholders. Next, we will move to developing the goals and objectives for the simulation activity. Remember, at any time, you may uncover key information that drives you back to the problem identification stage to further clarify an educational need. Integrate targeted needs assessment data into goals and objectives. Learning can be divided into 3 domains. Affective. This domain includes objectives regarding the interest, attitude, and values relating to learning the information. Cognitive. This is the most commonly used domain. It deals with the intellectual side of learning. Psychomotor. This domain focuses on motor skills and actions that require physical coordination. As you gather data during the needs assessment, it will clarify which domains the learner needs lie within and inform your creation of goals and objectives. Writing goals, objectives, and outcomes in simulation-based activities. Goals are broad and lead the general direction of the project. Objectives are specific and measurable and set the stage for what is to be experienced. They help educators prioritize and set the content. Outcomes are measurable results of what the learners will achieve in their practice at the conclusion of the simulation activity. How do you write SMART objectives? I am sure as simulation educators, you've seen the information on the slide before you many times. The creation of appropriate objectives is crucial in designing a meaningful simulation-based experience for your learners. Your objectives need to be specific, measurable, attainable, relevant, and time-bound. When creating objectives, consider, are you measuring what you intended to measure? How will you measure it? What process do you have to ensure the learners obtain what you set out to achieve? Next, we will move to developing and selecting the educational strategy that will work best for your simulation activity. Not all simulation-based activities have to include the same modality or type of simulation. Collaboration with subject matter experts. As we begin to plan and design, we need to consider all the resources we have available to us that can impact our design process. Operations specialists and content experts are but a few. If we begin connecting and communicating early with them behind the scenes, it will ensure that our scenario is clinically relevant and also eases the implementation phase. We want to help them be informed on simulation best practices, but also utilize their expertise to support our learner group. Planning, assessment of the learner, and evaluation of the SIM activity. When it comes to thinking about the educational strategy, it is good to ask, how will the simulation activity best accomplish our educational objectives? In this course, we will refer to the assessment of the learner and the evaluation of the simulation activity. It may seem odd to bring this up now, but an educator will need to consider these early to make sure the learner assessment is congruent with the activity and that the activity evaluation gathers the correct feedback. Now let's consider the types of learner assessments. There are 2 main types of assessment, formative and summative. Formative is for learning. This is the bulk of the work that most simulation educators do. This is why we are so careful about crafting clear objectives, adhering to those objectives, creating a safe learning environment, and facilitating a reflective debrief. We want to allow learners the space they need to demonstrate their knowledge and identify gaps that need to be reconciled to progress their practice to a standard level.
Summative assessments are for validating a skill. This includes a learner proving that they have the knowledge and maturity to perform the necessary actions. Learners will be evaluated on performance and receive feedback. A subtype of summative assessment is high-stakes testing. High-stakes assessments carry consequences with poor outcomes. The participants may not be able to continue in their chosen educational program, or results may impact their employment status. If a simulation educator is coordinating these types of assessments, it is imperative that learners are fully aware of the situation in advance, that trained raters are part of the process, and that all learner evaluation tools are valid and reliable. These are highly standardized situations and usually use SPs or task trainers. It is very rare that human patient simulation scenarios are utilized in high-stakes assessment, as the whole environment is contrived and therefore could be questioned.
Determine the type of simulation-based activity. Think back to our targeted needs assessment. This helped us formulate the objectives for our project, and the objectives will help us plan for the best simulation activity based on the learner assessment types that we just discussed. Are these types leading you towards a procedural workshop with task training and deliberate practice? Or your learner needs showing you that a simulation scenario would be best? This can be for individuals or teams or systems testing. Simulation modalities used in assessment. Here are a few examples of how different simulation modalities can be utilized to support the needed type of learner assessment. Formative or summative. Just as you were correlating the simulation activity to the objectives and assessment type, you will correlate the simulation modality to the learner objectives, assessment type, and to further progress your planned activity. Designing simulation scenarios. As an educator, you've chosen the learner assessment type and matched it to a simulation activity to support this learner assessment. Now we can move into designing the simulation scenario or activity. When designing simulation events, it's important to incorporate these design elements: orientation, pre-brief, the simulation activity itself, a debriefing session, and/or feedback. One example of integrating a design element into best practice would be to have simulation educators orient and pre-brief learners even with procedural events. This would ensure that learners can understand safety expectations, what aseptic solutions can be used on the trainer, the anticipated flow of events, and that there will be a subject matter expert on hand to offer individualized feedback. Considerations of reliability and fidelity in the design of simulation activities. In contemplating our design, we want to think about ensuring that the simulation-based activity is going to actually meet the planned objectives, progress in the expected manner, and be repeatable. Some features that will promote reliability and fidelity are appropriate number of objectives, determining an assessment tool, identifying your learner level, selecting an appropriate modality, identifying the length of the simulation, and determining the best location. Incorporate planning logistics when designing simulation activities. Again, remembering back to the targeted needs assessment, we need to determine the learner's education and practice environment. This will help inform the objectives for our project and will also help us plan for the most suitable location. An example of this is that depending on your overarching goals and specific objectives, it might be that your bedside team, rather than having equipment and personnel transported to them for an in situ event, would be better served in coming to your simulation center. Planning simulation-based activities includes clear communication with all involved personnel during the design phase. We discuss collaborating early with subject matter experts to ensure that our simulation activity matches what learners would encounter in the clinical environment. We need to also remember the experts on our own team, having operations specialists to review equipment choices, network connectivity, and transport feasibility, or SP coordinators to ensure staffing and training of embedded participants is invaluable. Another facet of planning logistics is equipment and supplies. Only include equipment and supplies that will enhance realism and fidelity. Too many props or accessories can be overwhelming to the learner and distract from the intended purpose of the activity. Remember to balance potential risks and unexpected outcomes. As we continue in this phase of educational strategy, are you formulating your plan with safety concerns in mind? Think about the physical as well as the psychological. Some examples may be, are live defibrillators going to be used during the scenario? If your event is in situ, how are practice medications handled? How are unintended observers informed? How do you handle visitors and staff not participating? If a medical emergency happens in your space, do learners know how to access help? Do you have policy and guidelines on how to support learners who become distressed during a simulation or debrief? We need to continue to consider these ideas throughout the design and implementation process. Utilize a scenario design checklist. As you create, do you have a template that you use? This will help to keep you organized, support the consistency of designs, and make sure that you don't overlook a resource. A key component is the subject matter expert reviewing the scenario. Healthcare simulation educators are rarely the authority on the education we design. An expert must vet the plan at regular intervals to make sure the science and standards have not changed. Developing supplementary materials for team members and learners. As part of the communication with identified personnel, you may need to develop supplementary materials for team members and learners. Some examples of this might be, for your own team, handouts, links, or training materials to get them prepared for the content or for the equipment they may be using. It could be as simple as creating lists for moulage and equipment needs to ensure consistency during the preparation of each activity. Learners could benefit from documents being prepared to mimic their lab results or images that they are familiar with in the clinical area, or incorporating their handoff tools into the activity to ensure learner engagement. Identify assessment and evaluation methods. At the beginning of this stage of the curriculum development model, we touched on the need for planning out the learner assessment and the activity evaluation. We've already discussed the assessment of the learner, so let's move to the importance of having an encompassing approach when evaluating your simulation-based activity. Suppose you simply evaluate the learner's feelings or reaction to the activity. In that case, you may miss a design flaw in the chosen modality or technology that could be improved to accomplish the goal of the assessment. A comprehensive simulation-based education plan allows the individual components of the activity to be evaluated for their effectiveness in achieving the target of the course objectives. If the assessments miss the target, it is important to be able to see what part of the activity can be improved to meet those targets. Facilitator and simulation staff feedback is also vital to improving the simulation activity and should occur at regular intervals. Now that you understand the elements that you must consider including in your activity evaluation, just know that you need to plan for this evaluation during the educational strategy phase, or maybe even earlier if your stakeholders have been collecting data before you were consulted. Decide which component you will evaluate, what tool or survey you will utilize, and how you will obtain the survey results. Some centers use pen and paper. Other programs utilize a free survey platform. Other labs might use an iPad or QR code to access their own learning management system. Conducting a pilot test. It's exciting, it's almost showtime. Conducting a practice run is crucial. It is a standard of best practice. Make sure to have this run through with a sampling of people who are at the same practice and educational level as your learner group. A cardiac arrest plan for licensed providers will be enacted, need different resources, and will time out very differently by undergraduate medical students, and vice versa. The test run will show you flaws with the programming, equipment, or a need for an embedded participant to facilitate from within the scenario. It will also show you what is working well. Remember, if there is a deficiency in your design, this is where you want it to be highlighted so that you have time to make adjustments before the planned activity. Preparing items for the pilot testing. When you prepare, make sure you have everything ready, just as if this was the actual event. Print the papers, prepare all the meds, have the labels there. Make sure that this is your dress rehearsal, that you have all features ready to go during this test so that you can truly evaluate what is going to happen on the actual day of the event. Simulation activity modifications after pilot test. Be sure and take notes during your pilot test and record changes that would need to be made to enhance your scenario. Part of this will be having actual discussions with all personnel present during this activity. That would include your practice learners, your subject matter experts, and of course your simulation teammates. Update all the changes and then communicate those changes out before the implementation so that everyone is aware and prepared to go with the new plan. Implement simulation activities. Next, we will move from planning during our educational strategies phase into the implementation phase. Beginning a simulation activity. Previously in these modules, we have discussed the 3 phases of healthcare simulation: the pre-brief, the simulation, and the debrief. As we move into the implementation, we understand that how we start off sets the activity up for success. As simulationists, we recognize that the pre-brief allows the learner to understand the guidelines for the experience. During the pre-brief, we are orienting the participants to the environment, safety guidelines, and expectations regarding their conduct and interactions. This phase of the experience should relay objectives, flow of the event, mannequin or task trainer operation, other participants they may encounter, resources such as equipment or supplies, or being able to call out for assistance from other teammates, expectations of the participants and the observers. It will also include psychological and physical safety guidelines. While simulation's ultimate goal is the transfer of relevant healthcare knowledge that will increase patient care outcomes, our immediate concern is learner safety. If we make our learners feel respected enough, they will allow us to challenge them. Jenny Rudolph shares that if someone is safe, they will allow themselves to be uncomfortable and take risks. The pre-brief is our word, our bond. Honoring pre-brief promises will create a setting in which learners will be brave, try out new knowledge, and accept performance feedback. The pre-brief must be consistent, yet tailored to each simulation event. In situ simulation pre-briefs will include instructions that are not needed in your lab. Consistent doesn't mean that you're exactly duplicating. It means that you're going to always cover the same subjects, the rules of engagement, and physical and psychological safety. We want to allow learners to understand the risks with participating in the simulation, apprise them of any potential triggers, and help them understand that they are allowed mistakes and that no harm will come to the patient, i.e. our simulators, or themselves. Facilitating a simulation activity. Previously, in these recordings, we have discussed facilitation, but that was from a theoretical point of view. We are now moving from exploring theory that supports simulation into incorporating the ideas into the process and the daily workflow. Simulation educators don't just create curriculum. We also coordinate all the resources needed to implement the event. This includes providing oversight to ensure that setup is complete, supporting all personnel involved, keeping the scenario on track, adjusting plans to keep this activity on time, making sure all participants are adhering to safety expectations. We also will have contingency plans in place for technology trouble, for unexpected participant reactions or actions, or in the event of a difficult debrief. Many techniques have been developed to support our practice. Please review the evidence and choose one that specifically meets your needs. Once you have chosen a technique and you implement it, review the usability and reliability among all your facilitators. Facilitating the debriefing session. After observing the simulation activity, educators then transition into the debriefing segment of the event. We need to note that this is a key concept. One cannot facilitate the debrief of an activity they did not observe. Standards of best practice compel facilitators to have formalized understanding of debrief techniques, including how to appropriately apply them during practice. This foundation should include having participants debrief in a space away from the simulation experience, rooting the reflective process in the learner objectives, and fostering the open and respectful discussion of ideas. If other facilitation partners are involved, we are also responsible for ensuring their adherence to psychological safety and mentoring. Simulation practice requires the development of facilitators. Best practice indicates that there should be simulation experts included in all aspects of the design and implementation of the simulation activity. If there is a novice simulation educator involved in this process, they should be mentored and receive training on these best practice along the way. Each and every step, we need to support them as their practice grows. Facilitating reflection and debriefing. Simulationists facilitate reflective thinking for all participants and observers to ensure engagement in the debriefing process. Simulation educators utilize open questions rooted in the activity objectives to encourage learners to reflect upon their performance and observations of the event. We want learners to realize their correct actions and their knowledge gaps. Then they can begin to fold these discoveries into their own personal practice. Allowing adequate time and mental space is key for this action. To empower reflective thinking, we must allow enough wait time for learners to actually reflect. There are many debriefing methods and ways to incorporate self-reflection. While in-person sessions usually incorporate debriefing immediately after the session, virtual simulations might utilize a flipped model, actually peppering learner discussions throughout the experience. And some programs actually use journaling to promote personal insight. Encourage the transfer to practice. Not only do we want to promote learner self-reflection, we also want to promote critical thinking. Part of the power in debriefing is to foster the transfer of newly acquired or newly adjusted knowledge, skills, and abilities into clinical practice. Ensure that you're helping learners make connections by looping back into your learner objectives and utilizing your subject matter experts as a resource during the debrief. Evaluate and improve simulation activities. Finally, we move to actually evaluating the simulation activity and analyzing the feedback. This relates directly to your design process where you proactively determined how you would evaluate the activity and solicit feedback from the learners, facilitators, subject matter experts, and members of the simulation team. Review simulation activity evaluations. All types of evaluations can help us better understand and critically evaluate the process of sim, the experience itself. It's important to evaluate all aspects of your simulated activity, utilizing a 360-degree approach. Review the overall success of the scenario. Look at your timing. Was time allotted for setup, scenario, and debrief sufficient? Did our facilitators adhere to our policies and utilize a pre-brief checklist? Was all the simulation equipment in good working order, and were the supplies available? Analyze simulation activity evaluations. Now that you've received the feedback data from your learners, facilitators, and simulation staff, it's important to make time to analyze and identify any opportunities for improvement. The whole simulation team, including facilitators and stakeholders, if possible, should be a part of this analysis. They have specialties and expertise that will allow them to have insights that may escape you when you are going over this data. We want to remember, did this event do what we thought it would do? Was anything missed? Do we need to make any adjustments to better serve the learners or clear any unintended barriers? We also might need to consider if there were any technical failures or mechanical issues. Incorporate the concepts of reliability and validity when analyzing simulation activities. Look at the individual components of the simulation activity and ask questions regarding reliability and validity. Many factors will affect these two elements. It is important to remember that newly designed or borrowed scenarios or borrowed tools need to be assessed for validity and reliability for not only your organization, but your specific learner group. Modify future simulation activities based on analyzed evaluations. After you have received all your feedback and analyzed it with your team and other experts, you realize there may need to be some modifications. Maybe there need to be some adjustments to the scenario case, training or support for teammates, or there might be an additional need for other resources. Please keep in mind if changes are made, this may impact reliability and or validity. As an example, let's say you increase the number of learner objectives for a simulated clinical experience from 2 to 7. By adding on these objectives, there's probably going to be several more pieces of equipment that need to be used and or body systems that need to be assessed. In that case, reliability may be disrupted. The learners will have more paths to explore. The introduction of more variables can very well decrease the simulation's ability to be consistently repeatable. Not all changes will alter your reliability and validity, but you must critically examine any alteration from the activity's original intent to make sure. Special considerations for simulation activities. Interprofessional or interdisciplinary simulation activities. Interprofessional education is defined as when two or more professions collaborate as a team during an educational event to improve health outcomes. An example of this might be a scenario that you designed for an emergency department where a trauma surgeon, an emergency medicine provider, respiratory therapist, radiology, PharmDs, and registered nurses come together to participate in the scenario. Interdisciplinary education is when two or more disciplines from the same profession collaborate as a team during an educational event to improve health outcomes. An example of this might be a de-escalation scenario whose participants are behavioral health RNs, safety attendants, and psychiatric healthcare technicians. Please note that whether it's interprofessional education or interdisciplinary education, it means people with different points of view are coming together to impact the care given to an individual. IPE or IDE is the same. When designing interprofessional or interdisciplinary events, educators must recognize the unique criteria for developing and implementing these simulation-based activities. Interprofessional education, or IPE, is when healthcare simulation experiences are designed by and for groups of people from different educational backgrounds with different scopes of practice. This means that from the very beginning, a subject matter expert from each and every group that will be represented in the final product is actively participating in the curriculum build and implementation of the planned event. These activities are important in foundational education courses and in the post-licensure professional environment. Growing high-functioning teams that values communication is essential to treating the complex needs of severely ill patients. The Interprofessional Education Collaborative, or IPEC, as you will hear and see it abbreviated, has designed 4 core competencies that are the national standard for objectives when creating IPE events. Be sure to familiarize yourself with these standards, how they impact IPE simulation design, and incorporate them into your own practice. The core competencies include values and ethics, which speak to the team working together to maintain a climate of shared values, ethical conduct, and mutual respect. Roles and responsibilities. That's when you use the knowledge of your own role and recognize the expertise of other team members to address individual and population health outcomes. Communication. Communicating in a responsive, responsible, respectful, and compassionate manner with other team members. And last, but certainly not least, applying the values and principles of the science of teamwork to adapt your own role into a variety of team settings. Conducting distance or virtual simulation activities. This is a new area represented on the blueprint, and remote learning is not in our CHSE reference manual. Distance education and virtual simulation are not new ideas or concepts. However, 2020 highlighted them and pushed them to the forefront. Research has shown us that when we are conducting distance or virtual learning, we should use the same principles that we've already discussed in earlier modules related to activity design. But we do need to consider some nuances. Those are listed on the slide in front of you. Let's just chat about a few. Again, virtual simulation is a category, and within that category, there's still a lot of options for you to choose from. You're still charged with choosing a modality that will meet your learner needs. Those objectives that you work so hard to create, that's what your modality must align with. I think a test run is still very essential, especially practicing because of technical and connectivity issues. This also brings us to, does your virtual product that you use in your program, does it have its own built-in help access for your learners? Or have you created a tips and tricks sheet? Because psychological safety is really hard to achieve if they are very concerned about being late because they couldn't get on, or they're stressed because they didn't understand they were supposed to have a camera and a microphone, and that is an expectation that they have a camera and a microphone. This is a clinical experience, and most of our learners take that very seriously. We need to know how to uphold confidentiality, and again, above all, achieve those learning objectives. So y'all, thank you so much for spending this 45 minutes with me as we finish up Domain 3 in this 4th module of your Moodle course. I'm very grateful to have spent that time with you. Please do use your resources that you have to take deeper dives on any of these ideas or concepts that we went over in this recording that you may not be as familiar with. And make sure to write down any questions or concerns that you have and bring them to your live session. I look forward to hopefully meeting you sometime, and I hope you have a good rest of your day.